Hi, everyone, and good morning, and welcome to our monthly Facebook Live. Each month, Joe DiMaggio Children's Hospital, we go live here on Facebook to talk about trending topics and what could be more trending and more important right now than COVID-19 and our kids heading back to school in Miami-Dade counties and Broward counties. So good morning, everyone. My name is Kristen Hewitt. I'm a South Florida television reporter and parent, like many of you watching. So today we thought it would be important to have breakfast with Dr. Chang. He is our chief of the Pediatric Allergy and Immunology Program here at Joe DiMaggio Children's Hospital. There's Dr. Chang. Good morning, Dr. Chang. How are you?
Hi, everyone. Good morning, Kristen.
Thanks so much for joining us. I know that this is taking a lot of time out of your busy schedule, so we really appreciate you helping all the parents with all their COVID-19 questions. So just a reminder to our community, if you have any questions for Dr. Chang, you can submit those in the comments. We can see those and we can add them here. He'll try to answer as many as he can. Also, please share this broadcast. I'm sure there's tons of parents and students and educators that you know that are interested and would like to hear this broadcast. All right, Dr. Chang, so let's just start with the basics. Can you give us kind of a breakdown of what the COVID-19 landscape is right now in our community?
Well, as you know, Kristen, it's not good news. Over the last couple of months, we've had a surge in cases. And if you look at the acceleration of the cases, it's pretty much very close to or maybe even surpassing the surge that we had last summer. So this is in spite of having a portion of the population vaccinated, we're still experiencing another surge right now.
Yeah, we're hearing about that on the news. So I guess what many parents want to know, Dr. Chang, is what's different? You know, we had the pandemic sweep through this last year, last summer, kids started school online, but what's different that you're seeing here at Joe DiMaggio Children's Hospital as it relates to the Delta variant?
Yeah, well, I think that, you know, when the vaccine came out last year in late December or mid-December, we all hoped that we would be seeing the end or the light at the end of the tunnel. Unfortunately, viruses are very smart too, and they mutate and they come up with these new variants. And one of the ones that has really predominated in the United States recently is the Delta variant. And one of the characteristics of the Delta variant is that it's much more contagious. In fact, it's probably about fourfold more contagious than the original variant. We have a calculation called R0, which is basically the number of people that one person can infect. And whereas the original variant, the R0 was 2, in contrast, the Delta variant is estimated to be between 6 and 8. So you can see that it's much more contagious and therefore it's spread much faster, which accounts for the rapid increase in cases, despite the fact that we have a portion of the population vaccinated.
So what are we seeing at Joe DiMaggio Children's Hospital? Already people are asking, you know, what are we seeing in terms of kids coming into the hospital with COVID-19 during this Delta surge?
Yeah, well, so it also appears that the Delta variant may actually be affecting children more. This is partly because there are a lot of children who are not vaccinated, and even in the 12 to 17-year-old age group, we have a lot of patients who are not vaccinated, and so the Delta variant has been able to spread among this population. We also it's not entirely clear how effective the vaccines are against the Delta variant. They probably are somewhat effective, maybe not as effective as against the original variant, and this is not an all or none thing. You know, we can have people who may be partially protected and not completely protected. So this might account for the spread. We also don't know if the vaccine prevents people from actually spreading the Delta variant if they're asymptomatic. So that can also account for the rapid spread of the Delta variant. The end result of all of this, of course, is that we have more kids who are being seen in the hospital with COVID-19. In June, I think in our emergency room, we only saw 23 kids with COVID-19. In July, it was 241, so that's over a 10-fold increase. And in August, we're at August 10th now, and we are already seeing almost half of the number in July, and we're not even halfway through the month. So definitely it's increased a lot. And not only that, I think that with the Delta variant, we're seeing more severe illness, and the old thought that kids who get COVID-19 don't get sick. I think with the Delta variant, that's not entirely true anymore.
Right. So to answer a lot of the parents' questions in the chat, and I'm not going to put all of them up, but the difference then, what you're saying in the Delta variant is in the past iterations, we're not seeing as many kids contracted, but right now we're seeing, a lot more kids. It's spreading and they're coming to the emergency room for treatment. Right.
Yeah, definitely more kids infected and who are sicker as well.
Okay. So as this is, what we're talking about, back to school is here. Broward County schools, Palm Beach County, Miami-Dade County, they're preparing to open schools. So let's talk about masks. I know the CDC came out with some guidelines as schools prepare to open. How important is it for educators and administrators and visitors and kids to wear masks in school to start the school season at least?
Yeah. Well, the CDC recommends that masks be worn indoors. And I think that this is really important because when you have masks have been shown to be able to prevent the spread of illnesses and the spread of all viruses, actually, because a lot of these viruses are airborne. So if you keep them from being released into the vicinity, then it can definitely help prevent spread of the infection. So masks are definitely very important.
We're getting a lot of questions, and I know we were planning to talk about this anyway, but I'm going to see if I can add this question in. Ms. Cabrera asked, what are the best ways to protect kids as they go back to school? I know we're going to talk more about masks, but are there any other, layering or mitigation strategies that you recommend, in addition to masks, like social distancing, et cetera?
Yeah. Well, I mean, the best way to treat COVID, obviously, is to not get it to begin with. So this is why preventative anything you can do to prevent getting it is important. Masks is just one way. Vaccinations is another. You want to get vaccinated. You want to wear your mask as much as possible, and it doesn't hurt to go beyond what the CDC recommends. You can choose to wear your mask more often or in more situations, especially if you're around other people. Even outdoors, if you want, that's up to you. So I think that's probably the best way to prevent getting COVID-19 is to wear your masks.
We had a question, and you may or may not know the answer to this, so let me pop it in here for you to see. Is there any study of long-term effects of COVID on kids? I would imagine this is MISC, but I don't know the answer. Do you have an answer to that, Dr. Chang?
Yes, MISC is the primary long-term effect that we see in kids. There have been much more studies done on adults on the cardiovascular, the respiratory, and the neurologic sequelae of COVID-19. Not so much in kids. With kids, it's mostly MISC. But I imagine that there are, we all hear anecdotes about kids who have had COVID-19, and then they're takes them a while to recover, so I think that that's going to come out and as the research gets going. And especially as more kids get COVID, unfortunately, we'll have more information. It would be nice if we didn't have to do that, but with the increasing cases, we'll definitely have more information to do research on long-haul effects.
I want to get back to masks, but we have, I want to get into masks and how important it is for them to wear it. In the beginning, when COVID first came out, there were a lot of studies done on the effectiveness of masks, if all are wearing them or none are wearing them. So I guess I want to start with how effective, Dr. Chang, are masks? If everyone is wearing them universal, and how effective are they if not everyone is wearing them?
I think the way to think about it is this: if everybody wears a mask, that means that everybody is participating in preventing the spread. If one person takes off a mask, then obviously there's more. And that person is infected, then there's more viral particles in the air. If two people take off a mask, then it's even more. And you can imagine how if you end up with half of the people not wearing masks, it doesn't mean that the risk of getting COVID or the effectiveness of the mask decreased by 50%. It actually decreased by much more, because now you've kind of disrupted that whole universal mask approach where everybody is sort of protecting everybody else. So there's kind of this interplay where every combination of people who wear masks around each other are really protected. You take away one of those and you kind of break that overall protective effect. So I think that it's really important for everybody to wear a mask.
Yeah, absolutely. And I know this is something you and I have talked about, Dr. Chang, but it's not just what type of mask you wear, right? Because wearing a mask under your nose isn't going to help kids or teachers. And I know that happens a lot. So let's talk about the fit of the mask, how important that is, and the proper way to take a mask on or off.
Yeah. So one of the studies early on looked at masks and how effective they are. And they looked at different types of masks, N95 masks. They looked at cloth masks. They looked at surgical masks. And they found that surgical masks and cloth masks are actually very, very, very effective. There are some that are not so effective. Generally, when they talk about cloth masks, they tell you to have the type that have several layers, and that helps the effectiveness over the single layer masks. They also talk about this gap in between. So when you put on a mask, you hold the ear pieces or whatever you call these, and you put your mask on like this, and you don't touch the mask. I'm going to touch it now just to show you something. But you really want to seal as much as possible. So, don't just kind of just let it lay over your nose and mouth here, but you really want to kind of pinch it so that you're kind of creating the best seal possible with these surgical masks and cloth masks as well. The other thing, I see a lot of people wearing masks, they're wearing it like this, and so that really doesn't help because, you're still breathing in, breathing out through your nose. So definitely you want to pinch it as much as possible. And if you can get a good seal, and in the studies, they looked at less than 10% of a gap throughout the perimeter of the mask, gives you a pretty good effectiveness, close to like 96, 97% effective. So I'm going to take it off, and that's how you take it off. And you put it down on a clean surface, and when you're ready, you can put it back on again.
And as you just said, what are the best masks for children? And as you just said, cloth and surgical masks are effective. KN94s, KN95s are obviously, are those better, or they're equal, or we don't know the effectiveness of those?
Well, the benefit of KN95 mask is that, and I don't have one here to show you, but they actually do fit better. They create a better seal, and the particle filtration is a little bit better also. So those are the best type of masks. I mean, there may be a little bit of availability may not be as widespread. We now have no shortage of regular surgical masks, and cloth masks are being sold by almost every clothing vendor. So, they're easy to get a hold of, and they're effective if you wear them properly.
This is another great question from Judith that I want to pop in here, and then we'll move on to some other questions I have for you. She asks, if none or very few other kids in my child's class are wearing a mask, does it even matter if my child wears hers?
That's a really good question, and I would say yes. But remember that it would be much better if everybody wore a mask, and if your child has a mask on, there's some protection, but remember, there's a gap. No matter how well you seal that mask, there's a gap, and particles can get in. So it will help. This is an additive effect. When you're trying to prevent COVID, you want to do everything you can to prevent getting COVID, and masks is just part of one. Everybody wearing masks is obviously better than just you wearing masks, but you wearing a mask does help. I mean, it does provide one layer of protection. But remember, there are layers and layers of protection. And I have this saying or motto that they talk about is that whatever you're doing or we think you're doing to prevent yourself from getting COVID, you can probably do more. You're probably not doing enough. So, it's only enough if you don't get COVID. Once you come down with COVID, then you realize that it's not enough. You hadn't done enough. So whatever you can do helps. And as you layer on these things, then you get better and better protection.
Dr. Chang, a lot of people in the chat are asking what MISC is. I know you and I know what it is because you see it in the hospital, and we have cases of children and pediatric patients that have MISC. But can you explain what that is and how it comes about after the child has COVID?
Yeah, so COVID is a viral infection. And we know that one of the things, especially from the studies in adults, that cause people to die of COVID was not necessarily the virus itself, but the host response to the virus. In other words, when you're infected with a virus, your body reacts to try to get rid of the virus, but also in the process can generate a lot of these inflammatory, what we call cytokines or molecules that attack your own organs, different organs. So MISC is sort of a version of that. It stands for multi-system inflammatory disorder, a disease of children in COVID-19. And so what it is once you've been infected with the virus, your body has cleared the virus, but in the process has generated a lot of these molecules that are inflammatory molecules that attack your heart, attack your lungs, and other systems. And then you see this sometimes occurring 3 to 6 weeks after COVID infection. So it's another one of those long-term effects of COVID.
Dr. Chang, we're getting another question, and I'm smiling because I asked you this question. So Megan Turner wants to know, should we be doing vitamins or supplements to boost the immune system, knowing that you can't obviously, you can't give patient advice because we don't know the child, but what's your take on the health craze right now, especially in alternative medicine, to boost kids' immune system?
Yeah. So, there's been a lot of discussion about different vitamins like vitamin C, vitamin D, zinc, and people take zinc for viral infections and colds. The truth is that there's been a lot of research done with these supplements and these minerals that have been done in the lab that do show that they have an effect on immune system. How much they will do to protect you from getting COVID is really unclear. Now, if you feel like you want to take vitamin C, there's no harm in that. Whether or not it's going to actually protect you from getting COVID, it depends on a lot of other factors. It depends on your exposure. It depends on perhaps the dose of virus that you're exposed to. So I can't really say whether or not it will help you prevent any given person from developing COVID. And they're not really, in real life, they're not really immune system boosters. In other words, they don't make you invincible to, infections and viruses.
We're getting a lot of questions about immunocompromised children and kids with asthma, which was one of the things we definitely wanted to talk to you about. So, how safe is it for kids to be back in school if they're immunocompromised? Can they get the vaccine if they're 12 and older? If you could, this is what you do for a living. You work with these kids. So if you could kind of give us a breakdown on that.
Yeah, so unfortunately for the immunocompromised, they're more susceptible to viruses and other infections. And so this is one of those groups that is not as well protected by virtue of their own immune system. One of the things, though, is that many of these children, even though they're immunosuppressed, can still get the vaccine, which is, if the vaccine is approved for that age group, we would definitely recommend getting the vaccine because that will help develop some immunity in those kids. Maybe not as good as a non-immunosuppressed child, but definitely we recommend getting a vaccine. You would definitely want to talk to your immunologist or your primary care doctor about that, or your pediatrician about that. But we don't see, in general, any harm since it's not a live vaccine. It is a mRNA vaccine, which is not a live vaccine. So they can get the vaccine, but they are more susceptible to getting COVID. And we would definitely advise doing more of the precautionary stuff with masking and all that, and being a little more careful if your child is immunocompromised.
A lot of people are asking when the vaccine will be available for 12 and under. We do not know that answer. I asked Dr. Chang that myself. I'm mom of a 9-year-old. So everyone in the chat, I promise I've been asking that question as well. Unfortunately, we don't have an answer. I want to get back to masks really quickly because I know we have a lot more questions to get to, but a lot of parents, are talking about how dirty cloth masks can become. So let's break this down. How often do cloth masks need to be washed? And if you do have a KN94 or KN95 or a surgical mask, can those be reworn or do they need to be discarded each day?
Well, I would say this. I would say if there were an unlimited supply of every kind of masks, then I would probably change them or wash them every day. But I think cloth masks, you can still do that. With other types of masks, if you're wearing a KN95 masks and they're relatively more scarce, then you might need to reuse them for a few days. Surgical masks are probably pretty easily available now. So if you want to change your surgical mask every day, that's probably a good idea.
Got it. Dr. Chang, you may or may not know the answer to this one, but do you know what the main symptoms are that they're seeing in the emergency department right now?
So for long COVID, I don't have numbers. The most of the studies on long COVID, other than MIC, have been done in adults. A lot of the symptoms are that people complain about are neurological symptoms where they have difficulty concentrating, or they don't feel like they're focused, and so those are some of the long haul effects. MISC is more of a physiologic long haul effect where it does affect your organ systems like the heart and so forth. So. But I don't have exact numbers. I don't think those numbers are available as of yet.
No, I didn't mean numbers. I just meant symptoms, but that's fine. I want to talk about this because we've received this question multiple times through our social media platforms and direct messages. A lot of parents are asking, should we buy HEPA air filters for our child's classroom, especially, you know, in the elementary schools where kids cannot be vaccinated? I know you have found studies on this. So what's your take on HEPA air filters for a classroom?
Yeah, so air filters filter out particles of a given size, and the virus particles probably are at the tail end of the ability of the air filter to be effective. So I think if you use the air filter long enough, you eventually will slowly kind of remove those size particles, but you kind of have to run them for a long time. A side note to that is that ionizing air filters probably don't help. Ozone, you have to be careful because ozone can be toxic. And then there are also these UV lights, which actually do help kill viruses. But again, how effective that is in preventing COVID is unknown.
Got it. But as you said before, if what you're doing, you probably aren't doing enough. So HEPA air filters couldn't hurt in classrooms.
It couldn't hurt. Yeah.
Okay, gotcha. Okay, what do you say to parents that say there are very few kids hospitalized right now? Why do I need to be concerned?
Well, that was probably true last year, but again with the Delta variant, that seems to be it seems to be changing. It seems to be that kids are much more likely to be affected by the COVID-19 and get ill from the COVID-19. And we, as you can see from our ER numbers, we're seeing a tenfold increase in July over June. So you know, people don't come to the ER unless their kids are sick. And we also have a lot more in the hospital kids with COVID. So I think that this whole notion about kids not getting sick from COVID or getting COVID as much is now changing because of the variants. And I should also warn people that, and Dr. Fauci has said this too, and a lot of other of the leading scientists have cautioned us that Delta variant is only one variant. There could be other variants coming out in the future. Some may be even more contagious or may cause more severe disease or different type of disease than the current variant. So we have to be wary of that too, which is, again, is another reason. Well, I think we're going to talk about vaccines in a minute, but just let me mention that with vaccines, if you don't get vaccinated, that leaves the virus to be out and they're spreading. And viruses are like anything else in life. They're living, well, they're not living necessarily, but they're organisms that follow Darwin's law of evolution. So it's survival of the fittest. It's the virus that is going to be able to be resistant to vaccines that's going to flourish. So, you know, if we only have 50% of people vaccinated, then there's other 50% of people out there. The virus can kind of infect those people and then eventually become even stronger. So it's really important to get as many people vaccinated as possible.
I'm going to get to vaccines in 1 minute, but I want you to read this one question. If you have already had COVID, are you immune or should you get the vaccine? She goes on to say at least one shot. How susceptible are you to getting it again?
Repeat COVID has been reported, so you can get it again. You will make antibodies if you have COVID-19. However, the recommendation now is that if you do have COVID-19, you should get vaccinated after you recover from the COVID-19. And no longer is the recommendation to wait 90 days. Now you can get it right after you get better from COVID-19.
I didn't realize that you could get the vaccine right away. That's excellent news. So that brings us to the topic of vaccines. At Joe DiMaggio Children's Hospital, as of yesterday, we have vaccinated 1,050 children or adolescents, 12 and older. How important is this for parents that are on the fence? They've heard they have some concerns about the vaccine. How important is it to get it before the kids go back to school?
Yeah, I think it's incredibly important to get vaccinated. Everybody should get vaccinated. In fact, when the vaccine comes out for the kids under 12, I would also recommend that everybody get vaccinated. We can only end this horror pandemic if everybody gets vaccinated. And you can see that, as I mentioned, as the number of people that are coming into kids who are coming into our emergency room who are 12 to 17 years old is increasing dramatically. We've had an increase in the number of people coming in with their kids, teenagers who qualify for the monoclonal antibody, which is used to treat COVID once you get COVID. So we know that the numbers are definitely increasing, even in that age group. And we know that there are a lot of 12 to 17-year-olds that are not yet vaccinated. So I really encourage you to get your 12 to 17-year-old child vaccinated. And then when it comes out for a lower age group, the same thing. I would encourage you to get vaccinated as soon as possible.
Dr. Chang, if you could just address this one thing, because there are a lot of questions in the chat that I know you can't answer because we don't have a ton of data yet on the Delta variant and how it's affecting kids. So if you could just kind of explain that the Delta variant is different now, right? In the first summer surge, we weren't seeing as many children come to Joe DiMaggio Children's Hospital, which is all that we can talk about because that's who we are and that's who we treat. Right. So why is it so hard to answer some of these questions? And, and how many months will it take before they have enough data to understand how this variant is really working in children?
Well, I think we're already seeing it, Kristen. I think we're seeing that the variant is more contagious and the variant does cause more severe disease in children. I think we're already seeing that. As far as long-term effects, yes, that will require a longer time in order for us to analyze some of these cases and find out how many are coming back with long-haul effects. But we're already seeing that kids appear to be more affected by the Delta variant.
Dr. Chang, if you could just address your concerns about the side effects from the vaccine versus the side effects from COVID, because I know a lot of parents are concerned about giving their children the vaccine, right? Mm-hmm. They're 12 and up. A lot of parents themselves have gotten the vaccine, but then they're scared because they hear about side effects of the vaccine. So let's talk about that. The side effects of the vaccine versus the side effects of COVID. I'm assuming the side effects of COVID are much worse.
Yeah, I mean, the way I like to think about this is certainly anything you take, any medicine you take, any vaccine you get, there is a chance that you could have a side effect or you could have an adverse event happen because of it. There is always that chance. But the number of people who have had bad effects from a vaccine or a COVID vaccine is very, very low. It's extremely low. And one of the things that I think that has been at least documented is this myocarditis in young males, adolescents and young males who get the COVID vaccine. Again, the number is very low. And the way to think about it is if you get myocarditis for the vaccine, if you got COVID-19, can you imagine how bad it would be? So, the vaccine is really a attenuated version, if you will, of the actual viral infection. So I like to think of it that way. And I like to think of that as a way to encourage people to get the vaccine, because it's true. If you get COVID-19, you could have much worse effects than from getting the vaccine.
I know that you have to go in just a couple minutes, Dr. Chang, but I'm just curious if you know the answer to this. How does COVID-19 affect kids differently than it affects adults? Do we know that yet, or does it affect children differently?
Well, I think that in the early days, we thought that it didn't affect kids and the kids didn't get as sick. But I think we're seeing a lot of the same type of illnesses now with kids getting the Delta variant. In fact, who are admitted to the hospital, who are now ending up in the intensive care unit, just like the adults, with the same type of illnesses and the same type of host response that causes a lot of the organ damage. We're seeing that now with the Delta variant. And so I think that it's important to realize that this virus now is starting to affect kids the same way it did earlier on. The original variant affected adults.
I know you have to run, but I'm going to ask you this one more question from our community because it's an interesting one. If my child is vaccinated and plays an outdoor sport while not social distancing or masking, can he still get the virus?
Unfortunately, yes, he can. Again, the vaccine it doesn't make people invincible. It is one of those layer of protections that I talked about. It's extremely effective, but there are going to be some breakthroughs. So far, out of 120 million doses or whatever around that number of doses given to Americans, there have been about 6,000 breakthrough infections. So it's not impossible. Obviously, 6,000 out of 120 million is very rare. So your chances of getting COVID are much decreased than if you were unvaccinated, and that's one of the reasons to get the vaccine. But it's not a shield of armor, as our CMO, Dr. Ford, tried to make that point. It's not going to protect you no matter what. I mean, you can't just get the vaccine and say, I'm going to do whatever I want to do now, and I'm never going to get the virus. That's not going to happen. You still have to take precautions. In fact, after I got the vaccine, I really didn't change my behavior much. I still wear masks when I'm around people, indoors, outdoors. I do it as much as possible because, again, I realize that it's just one of those layers of protection that makes me even less likely to get the virus.
Last question. Can a vaccinated high schooler be a carrier and bring the virus home to an unvaccinated member of the family? I think I know the answer to this one, but I'll let you answer.
Yeah, that's a really important point to bring home. And we don't, we don't know how. We always knew that there are asymptomatic carriers of the virus that can spread it to household members and susceptible people like elderly people. It seems like with the Delta variant, people can spread that virus even though they're vaccinated and they're not getting the disease. They seem to be able to still spread that virus. So it's important still to kind of take precautions, as I mentioned earlier. Still wear your mask, especially around susceptible people or around other people. So.
I just want to point out that the reason why Dr. Chang and I are separate today is so we can be unmasked. We are both in empty rooms. People are asking why you don't have a mask on. Dr. Chang always wears a mask, even outdoors, correct?
Yes. In fact, it's such a habit with me now that I sometimes maybe even wearing my mask when I'm in a room by myself. And when I'm on a WebEx with someone, they'll say, why are you wearing a mask? You're in a room by yourself. And I say, oh, I didn't even realize I had it on. So.
Yes, we normally do our Facebook Lives in person. Sometimes we do it masked, but because of the surge of COVID-19 in our community, Dr. Chang and I felt more comfortable being in two separate locations in two rooms, so we could be safe and you could see his face and really just understand everything he was saying. I know, Dr. Chang, we are getting so many questions in the chat. We could do this for another hour, but I know you're busy. You have a lot of patients to treat. So I'm going to let you go. I just wanted to thank you once again for your time and for answering the questions. And I might be texting you later to weigh in on some of the questions in the chat, if you don't mind.
Okay. Thank you so much, Kristen. Everybody stay safe.
Yeah, absolutely. And thank you to everyone watching. We really appreciate you dropping your questions. We'll try to get to as many as we can today with Dr. Chang, but just remember to stay safe. You can make an appointment at Joe DiMaggio Children's Hospital to get your child 12 and older vaccinated. We're going to put all those links in these comments today. So good luck with back to school. Wear your masks, get ready, and stay safe, everyone. We'll see you next month.